Hello, this is Dr. Ari Malavi coming to you from hidefacademy doing the 100-day liposuction challenge. Today's question is, can liposuction cause blood clots? Okay, so those are clots that form in your vessels. Typically, they form in the lower legs. Let's just talk about this a little bit. There's two types of clots that can actually form in your vessels, in your vascular system. One is like an actual blood clot, like a blood product that gets clotted up. That's called a deep vein thrombosis, typically. DVT is the name used. In addition, you can actually get a fat clot, like a little piece of fat that gets into the vein, theoretically at least. And then both of these entities can actually be detrimental to you if they flow all the way up to your lungs. And it can be a catastrophic consequence. So the question, can liposuction cause blood clots, is an important one. Let's start with the blood clot that's formed by the blood product itself. So anytime you have surgery where you're under general anesthesia, where you're completely asleep and you're not moving, that puts you at a risk to get a blood clot. It typically will form in your legs, okay? And what'll happen is that clot will stay there in the legs, typically, and it won't, and then it'll get dislodged when you actually wake up and you stand up. So going from a resting position to a standing position is when the clot can actually get kind of knocked off in there and then travel up to your lungs or heart and cause a detrimental effect. Now, to get a vein clot, you have to have, or a blood clot, you have to not be moving, meaning the muscles are not squeezing. So when your muscles are activated and squeezing, your lining of your vessels create a hormone that dissolves any blood clots, because blood clots are always forming and dissolving, and it's when that hormone doesn't get released systemically because your muscles aren't moving and you're not moving is when you're at risk at getting a vein clot. So one of the things that we do in surgery, even with liposuction, is we actually put on these compression stockings. They're called pneumatic compression stockings that squeeze the muscles in your legs to produce that hormone so that you don't get a vein clot. Interestingly, you can actually put that little pumper called the pneumatic compression boot anywhere. So any muscle group anywhere that's being squeezed will typically prevent you from getting a vein clot or a blood clot. Interestingly, if you do awake liposuction, so if you're actually awake, there's two forms of anesthesia that you can use. One is general anesthesia and one is no anesthesia. So awake liposuction is got a universal track record of never having a vein clot ever have formed because you're awake. So if you're just moving your muscles, you're never going to get a vein clot, okay? It's only with general anesthesia when you're asleep, where your muscles are not active, that you might get a vein clot. Now, on the whole spectrum of cosmetic surgery, is liposuction more prone to vein clots or blood clots? No, actually. Because when you do liposuction, it's very manual, very mechanical. You're often squeezing the body parts to do the liposuction. You're actually moving the muscles. You're compressing with your hand where the areas you're trying to move. So it's a very dynamic and very mechanical surgery. So it's actually protective. So liposuction in itself as a surgical discipline is actually protective of vein clots because it's very manual. You're turning, you're moving the body around, you're smushing on the tissues. So that's the answer for the vein clot. Now there's another clot that you get where it's called a fat clot, or you can get what is called a fat emboli, where you can imagine you're liposuctioning, right? So you're liposuctioning the fat out and you're actually teasing it out, whether you're using supplemental energy to help you or not. And so what happens is, theoretically, you could dislodge a little fat, and theoretically, if there's an injury or irritation of a vein or a vessel, the fat can get in and it can travel up and cause a fat emboli, which is also a very detrimental consequence of any surgery. Well, I'm here to rest assured for you guys that typically when we talk about fat emboli, it's not what you're thinking. So it's not typically that you push a piece of vein into a vessel directly, okay? And so let's back up for a second. So in and of itself, Liposuction is really not associated with fat emboli. It's when you're fat grafting, where you're returning the fat cells. You've taken them out, and then you're going to return some of them strategically to provide more contour, fullness. For example, in the butt, it's very popular to do BBLs, Brazilian butt lifts. And it's actually in that specific arena that fat emboli are seen more often. Now, they're very rare as well, but there's a lot of nuances related to fat emboli and why it happens in BBLs in particular. And it's not, again, we don't feel that it's a direct entry of the fat into the vein by the surgeon. What happens is there's a siphoning effect. There's a specific vein in the buttock area where when you're doing the fat grafting to the butt, that vein can get tethered and torn by the sheer swelling of the filling. And then what we feel happens is there's a negative pressure effect called the Emboli effect. And so that suction effect actually sucks the fat into that vein. Now, that vein will get tethered and torn very deep in the buttock area underneath the muscles. So one of the reasons we have a limitation or scope of practice in BBL surgery in particular is we're not allowed to put any fat back directly underneath the muscle. So as long as you avoid fat grafting into or below the butt muscle, you're really at very little risk, negligible risk of getting a fat emboli. So there you have it. We've talked about why liposuction is not a risk for getting blood clots in itself, although in surgery in particular, you're always at risk of getting vein clots. But there are other surgeries that are a lot higher propensity for vein clots, such as a tummy tuck. So that's out of the scope of this question, but I hope you found that answer to be helpful. And please follow us, and we encourage you to look up our other questions that we've answered. Thank you.